Well, first of all, I think we have to accept that there are inequalities simply by virtue of having a mental illness or suffering from mental distress. People with severe mental illness live 20 years shorter than people without severe mental illness. We know that if you have severe mental illness or even lesser forms of mental illness, anxiety and depression, you're less likely to be working, you're less likely to have a successful life in terms of career, you're more likely to have sickness absences, and you're more likely to have other physical illnesses as well. We know that people with mental health problems tend to be more excluded from society, in part due to stigma, but in part due to a lack of adaptation to their abilities and an adaptation to working environments. If you then add in the power imbalance between people providing care and people suffering from mental distress, there's further potential for inequalities in that professionals may not take into account social adversity and social exclusion and poverty that individuals experience in their life and understand those factors as being relevant to their mental health and well-being. And then if you factor in race, ethnicity and culture in the broader context as I've described it, the potential for an experience of inequality and for an enactment of inequality to lead to further disempowerment of patients is enormous. Not only do people from black and minority ethnic groups and refugees and people who are visibly different from the dominant population suffer social exclusion and discrimination in a society, in a political and social level, but if they feel different, they may not integrate in care systems, not seek help at an appropriate time, become fearful of authoritarian institutions, become fearful of the professions if they don't accommodate their health and well-being and their belief systems in their analysis of their problems.